All right, there are some positions that we want to cover that are very important for kind of an immediate response on your behalf, an educational response for your patients, should they become very, very anxious, very dyspneic at the moment of where you're at working with them, whether it's walking, running, interval trainings, not running because some of these patients are very sick, but some intervals, right? And you want to make sure that you have a strategy that you can implement at that very moment, aside from those relaxation techniques that may allow them to breathe better. So there are certain positions that we can utilize. So for example, with a patient who has obstructive disease, let's just say that you're walking with them and they get really, really short of breath. I can say, I want you to stop, relax, put your arms up here and kind of lean into it and just breathe. Now I want you to take the weight off of your upper arms, right? All the weight's on your legs. So lean into the table. This is not very stable, but we would find a very stable surface. Essentially, this is allowing the patient to relax kind of their upper body. Their strength is, they're standing themselves just on their legs now. This works great for your obstructive patients, not always for your restrictive patients, but it can. This is just a very good position for them to relax, allow more air into their lungs during breathing.
The other thing that a person could do would possibly be they could lean up against a table or a wall. So you could just have them kind of lean up against the table and take a break. Or also if you had a chair available for you. So let's say you were doing a chair follow, you could have them sit down. And then you could have them lean forward onto their knees and do some pursed lip breathing to help them slow their breathing and get more comfortable. Sometimes you don't have a chair nearby, that's why we might suggest a wall, or even along the rail in the hospital. They're just gonna hold the wall up, is what I call it, and their job is just to breathe and try to recover. This has been helpful for me when I've been working with patients post-cardiac surgery. Sometimes they get really anxious and dyspneic. They just had a big surgery and they're up walking a day after surgery and they're a little anxious about how that's all gonna go. And so sometimes we need to do some strategies to help them recover their breathing. And keep in mind with a midline sternotomy, their chest expansion is not working quite in the same way it might have. They've just had their sternum held open for quite some time. So the ribs are not working well, muscles are really tight, so they might not be working well to help support inspiration. And so patients tend to get a little bit more dyspneic, and we have to give them some strategies to promote them into more physical activity post-cardiac surgery.